network. A wildlife health professional, I mean, having different roles, they provide expertise. Basically, they are leaders in wildlife health. We work with different organizations. One which is formalized already between IUCN and the World Organization for Animal Health. So we really formalized a relationship. It happened one of the chair, Billy Karash, serves on both committees, so it helps to be sure we're working in the same direction. I mentioned ongoing discussion with the Convention on Biological Diversity. We work with the food, we have more contact, not formalized, with the Food and Agriculture Organization. They have developed a task force jointly with the Convention on Migratory Species, for example, and we work also with UNEP. Many things, I'm not going to expand on that, but just to illustrate that work is going on with the Convention on Biological Diversity. It's new area of work, so there are some joint publication, so you know that is going to happen, linking biodiversity and health. We have workshops also with the World Health Organization. We are discussing the creation of a liaison group formally recognized by the Convention on Biological Diversity, and there are some events, side events at the CBD COP or SABSTA, for those familiar with this acronym, so at all the Convention of Biological Diversity events. And the next one being next month in India, where there will be a meeting. What they do as well, they developed wildlife risk analysis tool, and that's, for example, I come back to the first time with all these specialist group logos. That's one thing they were involved in, so they developed this wildlife disease risk analysis to document a technical manual and guidelines for policymakers, and this was done in association with the invasive species specialist group, with the reintroduction specialist group, and the conservation breeding specialist group. And these invasives, reintroduction, we are moving things around, we are even talking about moving animals outside their original range, that's assisting colonization. We need to be sure we know what we're doing. Just also one thing there, come back to this slide I showed earlier, they are quite keen to try to develop to mitigate the risk before they, control the disease or detect the disease before they spread. So it's about species testing, having new baseline data, monitoring, and also to develop surveillance networks. And just to finish, we're keen to work, and I think that why we're here is to work on one health program that means tackling human, animal, and environmental problems all together. So we need this multidisciplinary approach. And we need also, unfortunately, because resources are limited, we need cost-effective approaches. Future opportunities, I think I already covered some of them. The need to discuss with other groups, which we are trying to do. We need to develop this surveillance to improve the networks. One thing we are keen also to develop, which is not sufficiently mentioned, that's why I put these slides earlier, it's the ecotoxicology problem, which is huge, which is a bilateral effect of health in a way, or tackling health problems. And I think we need to establish and promote policies and best practices for wildlife health as well. It's not only human, let's consider that. We need to do something for wildlife as well. And I'll stop here. Thank you very much. And if I may, I'm really sorry I'll have to leave because I'm on another panel in a few minutes on a completely different subject. So my apologies if you see me going. It's not lack of interest in the subject, but I have commitments that was asked by my organization.
Can I ask a question?
Of course, I was just actually going to say if anybody wants to ask questions, if he has the time to take any.
You were mentioning the risk of invasive species and trade of cats. Is it possible to try and use the health case in order to substantially decrease trading of pet industry, of the ornamental plants and projects.
Which case? Sorry, the pet case you said?
The health.
The health case, yeah.
Is it working? Trying to take the health case, which is lots of times much stronger with governments than the biodiversity case, and try to leverage it in order to substantially decrease the trade of animals and plants, which is very problematic both for endangered species, but also as a vector for invasive species. Because today it's a huge industry, and I think that the biodiversity case really cannot effectively control it, even though you have stuff like CITES and other treaties, but it's not actually decreasing the amount of trade.
Yeah. The response is yes, and there is one concrete example now. The most serious invasive species, there was some data yesterday at another event in the species pavilion. The most serious threat to native species is caused by domestic cats. So we have never managed to control domestic cats for many animal welfare issues. Actually, people are now trying to build a case that there is also a serious case with toxoplasma, and cats have a problem, and it's not just so it's quite an interesting debate. I'm some emails these days about that, just showing, and people trying to minimize the impact, saying no, it's just affect a few. You need to be careful. Just separate the pregnant women from cats, and we are fine. But actually, it seems not to be true. There are many neurological diseases that may be caused by toxoplasma. It could be a very serious public health problem, which is completely underestimated. So the response, just to illustrate, yes, which people are trying that. Whether it will get traction or not, I don't think it will work so that people will get rid of their cats. I think it's not going to work in this case. Or and for some species which are invasive, for example, I mean, many of them are completely out of control. We have the numbers. I mean, we use that all the time. Allergies, or some species are toxic, how much it costs. I mean, there is a, but in Europe, I can't remember, there is something like 11,000 species, and 45 of them have an impact, or an economic impact, or an impact on health. So we're using these numbers. It doesn't seem that it's, but we need to keep using them.
Thank you.
So you don't mind if I...
No, we understand.
Okay, thank you very much.
Right over here.
So I'm actually presenting this presentation on health and ecosystems analysis of linkages on behalf of my colleague Steve Osofsky, who was originally supposed to be involved in this workshop, but unfortunately couldn't attend the workshop. But I've worked with him on this proposal a bit, so I'll speak as knowledgeably as I can about it, and if you have any questions, I'll give you his contact details at the end. But I think it actually builds on very nicely to the previous presentation, and I think maybe gets at some of the issues you were bringing up in your question. So it's HEAL, as we call it, is a massive partnership, as you can see from all of these logos, and it's in the process of being implemented, and also we're still seeking funding for parts of it. So I'll talk about that towards the end. So we already saw this diagram from the Millennium Ecosystem Assessment, and what was really great about the MEA is that it very clearly showed how different ecosystem services contribute to different elements of human well-being, or different components of human well-being. And Jean-Paul was talking a bit about some of the health components of the MEA, but I would argue that that actually wasn't fleshed out very well by the MEA. I mean, these categories are quite general. So we know that ecosystem services are really important for human health, but we don't really know how and what some of those mechanisms are. Is there another way to click this? Oh, is there?
Do you guys know how to?
Okay, it's okay. I'll just do this. So in HEAL, we want to look at the multiple dimensions of health that we think are tied in some way or another to functioning ecosystems. And that can involve non-communicable diseases, communicable diseases, nutrition, and psychological health. And I'll talk actually mostly about disease and nutrition today. Oops, sorry. So we know that based on some work that Shahid Naeem and others have done, that when we transform ecosystems from complex, intact ecological systems to more simplified systems, as for example, agricultural systems, we typically lose regulating services and cultural services. And in agricultural systems, that's to maximize provisioning services. And we would, oh sure, yeah. Sorry. And so we typically lose regulating services and cultural services. And if you recall from the MEA diagram, those are the ones most directly, or those are some of the ones directly tied to human health. Provisioning services are as well. But we know probably less about some of the regulating services. And so what we want to do in HEAL is look at how some of these important components of human health change along gradients of intact ecosystems to significantly modified ecosystems. We still don't have a great idea of how that works, even though Jean-Paul showed that the EcoHealth Alliance has identified land use change as being one of the most important drivers of changes in human health. So our core research questions are essentially around one overarching question, which is whether, when, and how is public health a benefit provided by relatively unmodified ecosystems? And a bit more specifically, are there consistent and predictable relationships that exist between human health and degree of ecosystem alteration or modification? And if so, can important health differences be measured among human communities exposed to different levels of ecosystem alteration? And are the public health costs avoided due to the preventative health benefits of intact ecosystems additive to the value of other ecosystem services, like regulation of water quality and quantity, regulation of climate change through carbon storage or sequestration, and finally health, which is what we want to measure in this study. So what I'm going to describe tonight is several of the modules that comprise the portfolio of projects we're investigating in HEAL. And then I'll talk a little bit about some of the synthetic analyses we want to do across those different modules. One of the first ones we're looking at is the linkages between human nutrition and access to wildlife. And this is being led by Sam Myers of Harvard University. And these are the partners. It's quite a lineup of people. And so many of you may already be familiar with this, but we know that wildlife and human nutrition, the abundance of wildlife and human nutrition, are intimately connected. You know, in many developing countries, especially in rural areas, people are highly dependent on wild foods for nutrition, and particularly protein. About 1.5 billion people depend on fish for a significant amount of their annual animal protein intake. We know that animal protein is actually quite different from other sources of protein, especially with respect to neurological development. And terrestrial wildlife also comprises a significant proportion of human diets in Central Africa, the Peruvian Amazon, and other locations where it's been studied. But interestingly enough, it hasn't been studied in that many places. And so declines in both fisheries and wildlife can have significant impacts on human health and nutrition through impacts on nutrition. So what we want to do is we want to ask, is the nutritional status of mothers and children strongly associated with dietary access to wildlife populations? And that will depend both on this, and what's important there is both the diversity and abundance of wildlife populations, as well as the access. So for example, you could have significant populations of wildlife, but if they're in protected areas that people aren't allowed to access, then the impact may be the same as if those wildlife species weren't there. And does the burden of disease from maternal mortality, infant mortality, infectious disease, anemia, and reduced IQ significantly different in populations that have differential access to wildlife in their diet? And and just to finish that one up, we're asking that across a range of sites, including Madagascar and Western Canada. And then the next studies we're planning to do is to look at whether we can optimize watershed management to reduce not only waterborne diseases that people are exposed to in Fiji, but also some of the biodiversity loss that's occurring throughout watersheds and that impacts downstream coastal ecosystems. This is being led by Stacy Jupiter of the Wildlife Conservation Society with a range of other partners who are listed here. And the rationale behind the study is that if we can better understand the pathways of transmission for waterborne bacterial diseases, there can be significant implications for global health, or for public health globally. But we also think it's really important to have a better understanding of what the thresholds are with respect to biodiversity loss and ecosystem change that would allow natural resource managers to better develop interventions at reducing watershed degradation. And if we can understand both of those two bullet points, then hopefully we'll be able to understand if there's any synergistic relationships that will help us develop win-win outcomes with respect to biodiversity conservation and human health. So what we're trying to do in Fiji, where this study is based, is to understand the linkages between catchment modification and waterborne bacterial disease. And one of the reasons behind this is that our field staff in Fiji have noticed that after significant flooding events or extreme rainfall events, there are increases in waterborne diseases. And we don't know exactly how those mechanisms are working, but we hypothesize that in many cases it's related to degradation of the watershed. So we want to try to use molecular biology and markers, ecological markers, to see what those pathways of transmission are, particularly after extreme events. And we want to assess whether the mechanisms influencing downstream biodiversity and ecosystem change and ecosystem connectivity are the same mechanisms that are connected to the transmission of waterborne bacterial diseases. And if we can understand that, then we can start working with local communities and government at the provincial level and the national level to design holistic management practices that address both environmental sustainability and human health. And those sort of win-win outcomes are what we're really looking for throughout the HEAL project. Another module we're looking at is being led by Jonathan Patz, who has done a lot of work already on understanding some of the mechanisms that exist between land cover change and malarial distribution in the Brazilian Amazon. But in this study, we want to increase our ability to understand under exactly what conditions does habitat transformation influence malaria prevalence. And in Brazil, for example, the cost of increases in malaria after land cover change are typically borne by the Ministry of Public Health. not by agents responsible for deforestation or the Ministry of Forestry. So the idea behind this is that if we can better understand what some of these mechanisms are, both related to deforestation and how human communities interact with the landscape following deforestation, we can get a better understanding of how malaria prevalence is changing in these environments, and potentially who should bear the cost, the true cost of deforestation. So another study we're conducting is looking at the human health impacts of deforestation in equatorial Asia, particularly related to fire events and the air pollution that occurs as a result of deforestation and fire. And this is also being led by Sam Myers of Harvard University, and again has multiple partners associated with it. And the rationale behind this is that deforestation, fire, and air pollution are intimately connected. We know that deforestation is happening globally at very high rates, and that fire, particularly in equatorial Asia, is associated with deforestation both before and afterwards, often for clearance and then afterwards for crop cultivation.